On July 2, 1944, near the French port of Cherbourg, a figure in a loose-fitting white coat stepped out from the gloom of a subterranean field hospital. Blinking against the harsh daylight for the first time in days, the German nurse raised her hands in surrender, her mind still echoing with the conviction she had shared with her colleagues only hours before, that reports of American logistical superiority were merely enemy propaganda designed to break their spirit. 8 other nursing sisters followed her out of the fortifications, becoming some of the first female German medical personnel captured during the invasion of France. Inside the cave, they had spent the final, desperate hours of the siege tending to Wehrmacht casualties by flickering candlelight, forced to ration dwindling vials of morphine and endlessly reboil bandages for reuse. These women, who had been practicing medicine under conditions akin to medieval surgery, were entirely unprepared for the reality awaiting them. Within hours, they would be confronted by a medical system so advanced and abundantly supplied that it would dismantle not only their professional training, but the very core of the ideology they had been taught to believe. Colonel Richard P. Johnson, commanding the 45th Evacuation Hospital at Lamb, regarded the captives not with hostility, but with the professional curiosity of a fellow healer. Although these 16 nurses would be returned to German lines under the Geneva Convention on July 2nd and July 9th, the interim would expose them to a world of surgical techniques and pharmaceutical resources previously known to them only as rumors. This psychological unraveling had actually begun a year prior, on May 13, 1943, amidst the blistering heat of Tunisia. When General Hans-Jürgen von Arnim surrendered, his forces included thousands of medical personnel, among them the DRK-Schwestern, German Red Cross nurses, who had served alongside Rommel's Afrika Korps through 2 grueling years of desert warfare. Notable among the prisoners was DRK-Schwester Ilse Schultz, a recipient of the Iron Cross Second Class, a distinction awarded to fewer than 20 women during the entire conflict. Her colleague, DRK-Schwester Greta Volk, who had received the same decoration in April 1943, documented observations that would later surface in military archives, noting with disbelief that the Americans discarded more supplies in a single day than the Germans received in an entire month. The capitulation was massive, involving between 250,000 and 275,000 Axis troops, including staff from elite units such as the 21st Panzer, the 15th Panzer Division, and the 90th Light Division. While the majority of the medical captives were male doctors and orderlies, it was the nurses who would undergo the most profound ideological transformation during the subsequent processing. At collection points in Tunis, American officers sorted the personnel with remarkable efficiency, retaining those needed for German wounded while marking others for evacuation. By June 1943, after receiving comprehensive medical exams using equipment that had become a rarity in the Afrika Korps, the first groups of German staff were boarding mass-produced Liberty ships bound for the United States. The vessels themselves were a refutation of German propaganda regarding American industrial incapacity, boasting medical facilities superior to many hospitals back in the Reich. The nurses found themselves in operating theaters, equipped with reliable electric lighting, functional X-ray machines, and refrigerated storage. But the most shocking discovery was the abundance of properly typed blood plasma, a safe alternative to the risky direct transfusions they had been forced to perform in the field. During the Atlantic crossing, the disparity in resources became undeniable. While German forces rationed sulfur powder by the grain, Americans used it with abandon. Personnel who had survived on starvation rations watched in disbelief as American medics discarded single-use bandages and threw away uneaten food, wastefulness that would have been unimaginable in the Wehrmacht. Upon docking at ports ranging from Norfolk to New York, the prisoners' first view of the United States shattered the narrative of a nation crippled by economic depression. At the Norfolk Naval Base, the processing included dental care, infection treatment, and the provision of corrective lenses, a standard of care that far exceeded what was available even to German civilians at the time. As they traveled inland by rail, the revelations continued, with every urban center boasting illuminated medical complexes, such as the Medical College of Virginia in Richmond and the imposing hospital structures of Philadelphia. In Washington, D.C., when Red Cross volunteers boarded the trains to distribute luxury items like chocolate and writing materials, the German nurses, deeply indoctrinated in the ideology of racial struggle, found themselves unable to comprehend such generosity from their enemy. By June 1943, the first medical personnel from the Afrika Korps arrived at Camp Opelika in Alabama, which had opened the previous September. There, the camp hospital evolved into a unique environment, where German staff, trained in the tenets of Nazi racial medicine, worked side by side with Americans, practicing standard clinical medicine. In strict compliance with the Geneva Convention, the dual staff system established a unique medical hierarchy, where American officers supervised the operation, while German personnel delivered direct patient care. This arrangement created the unprecedented scenario of enemy medical staff functioning effectively within the American military infrastructure. German nurses were immediately astounded by the facilities, discovering operating rooms equipped with technology they had only seen in textbooks, such as electric cauterization, adjustable surgical lights, and rapid sterilization autoclaves, alongside a pharmacy that held hundreds of medications in climate-controlled storage with expiration dates extending years into the future. On July 21, 1944, Glennon General Hospital in Okmulgee, Oklahoma was designated as German Prisoner of War General Hospital No. 1, housing 1,690 beds, staffed by parallel American and German teams. Colonel Henry W. Misch implemented a strategy that would have been unthinkable in Nazi Germany: the creation of integrated medical teams that shared knowledge across enemy lines. German nurses, previously indoctrinated by the National Socialist Sisterhood to believe American medicine was weak and corrupted, instead discovered a system grounded in a rigorous scientific method. Perhaps the most significant challenge to the German worldview was the presence of African American nurses assigned to POW wards, a consequence of United States military segregation that relegated black nurses to treating prisoners rather than white American soldiers. German personnel watched in disbelief as these professionals provided skilled, compassionate care that contradicted every racial assumption ingrained in them by their training. Nothing, however, demonstrated American medical superiority more dramatically than penicillin. In 1943, the United States produced 21 billion units of penicillin. By 1945, that figure had skyrocketed to 6.8 trillion units. German medical personnel who had been operating without effective antibiotics witnessed the routine application of this miracle drug. At Camp Forest in Tennessee, which housed German POWs and extensive medical facilities, nurses observed recoveries they considered impossible, as infections that meant certain death in German field hospitals were cleared within days, allowing American doctors to save limbs where German surgeons would have resorted to amputation. American medical officers, many of whom were civilian doctors in uniform, shared their expertise freely, an openness that contradicted everything the German staff had been taught about warfare. The American blood plasma system represented another quantum leap beyond German capabilities, as proper typing, cross-matching, and preservation prevented the often fatal reactions caused by the direct transfusions still employed by German forces. At facilities like the 21st General Hospital at Ravenel, France, where captured German staff began working in December 1944, the blood supply operated with industrial efficiency. At these advanced facilities, plasma was stored for months, transported thousands of miles, and administered without the need to know blood types, capabilities that German medicine simply had not achieved. Nurses trained in the National Socialist ideology had learned that medicine served racial improvement, with an education focused on heredity and racial hygiene studies teaching that weak patients should be eliminated to strengthen the bloodline. Yet, at facilities like the 12th Field Hospital's 30,000-bed POW operation, they witnessed the exact opposite. American staff treated German prisoners identically to their own wounded, ensuring enemies received the same scarce medications, surgical procedures, and nursing care as Allied soldiers. This fundamental difference, medicine as universal healing versus a racial tool, began to demolish their ideological framework. Christmas, 1943, delivered a profound psychological impact when American organizations sent 500,000 packages to German POWs, each filled with wartime luxuries like coffee, chocolate, cigarettes, and soap. At Camp Alva, Oklahoma, which was designated for Africa Corps personnel, local churches sang German carols, Boy Scouts delivered handmade cards, and families with sons fighting in Europe sent homemade treats. The resulting Christmas feast of turkey, ham, vegetables, and desserts exceeded anything German forces had seen in years, leaving nurses to document their confusion at enemies showing Christian charity while their own propaganda preached hatred. By 1944, the Special Projects Division had implemented comprehensive education programs. German nurses attended lectures at institutions like the University of Nebraska Medical School at Fort Robinson, covering topics that revolutionized their thinking: medical ethics, patient rights, and the scientific method in clinical practice. The teaching method itself, which encouraged questions and debate, directly contradicted their hierarchical training, while access to American literature revealed the shocking truth that many medical advances had been pioneered by Jewish scientists expelled by the Nazi regime. The cognitive dissonance was overwhelming. As American medical personnel deployed to Europe, German nurses increasingly staffed military hospitals, such as the 45th General Hospital in Bari, Italy, which began receiving German prisoners on July 31, 1945. Working under the direct supervision of Colonel Charles A. Pfeffer, whose hospital treated all nationalities equally, from Allied soldiers to Italian civilians, German nurses found themselves using American techniques to treat patients their ideology had deemed inferior. American medical technology appeared to be decades ahead. X-ray machines, which were scarce in Germany, were routine here, and electrocardiographs, unknown to most German nurses, were standard equipment. At facilities like the 3rd Convalescent Hospital, operating from May to September 1945, German nurses learned to operate equipment they had only imagined, such as autoclaves that sterilized in minutes rather than hours, and electric suction devices that replaced hand pumps. Spring 1945 brought the most devastating revelation of all when liberation footage from concentration camps was screened for German POWs. Medical personnel who had served the Nazi regime faced an ultimate moral crisis, and while some initially reacted with denial, their resistance crumbled as evidence mounted. The testimony of American medical officers entering the camps, combined with photographs and letters from Germany confirming the truth, forced them to confront the reality of the system they had supported. These men and women had served a system that perverted the noble field of medicine into a mechanism for state-sanctioned murder. American officers handled this delicate situation with professional rigor, emphasizing that while medicine itself was not guilty, it must never again be used to serve ideology over healing. To enforce this, authorities implemented a targeted denazification program for medical personnel, mandating courses on ethics and democratic principles. These sessions used stark case studies to demonstrate how racial medicine harmed patients, while scientific approaches saved lives. At Camp Opelika, Lieutenant Colonel Dorothy Whitman arranged for German nurses to observe American practices firsthand, placing a heavy emphasis on proper documentation and patient advocacy. The underlying message was clear. Technical skill is insufficient without a foundation of ethical practice. Throughout their captivity, the German personnel were stunned by American medical abundance, watching in disbelief as hospitals discarded barely expired medications that Germany couldn't even produce, and replaced instruments at the first sign of wear rather than repairing them. This apparent wastefulness revealed a truth that directly contradicted Nazi propaganda. The United States produced medical supplies in unlimited quantities through industrial might, without the need to conquer territory. While Germany had fought to seize resources, America simply created them. Furthermore, American nursing practice fundamentally challenged the German professional identity. Where the Nazi hierarchy demanded unquestioning obedience, American nurses functioned as thinking professionals with significant autonomy. American nurses were empowered to question doctors' orders, suggest alternatives, and make independent decisions within their scope, a professional model completely unknown in the German system. Captain Helen Morrison at Glennon made the expectation clear, stating that nurses were responsible for patient outcomes and must speak up if something was wrong, regardless of hierarchy. This level of empowerment transformed their understanding of the profession, representing a complete reimagining of their role. The presence of African American medical personnel created a profound cognitive dissonance, as German nurses found themselves working under black professionals who demonstrated superior knowledge and skills. At Camp Florence in Arizona, Lieutenant Elena Powell supervised the German staff with a professionalism that directly contradicted the racial propaganda they had absorbed. Every time she corrected a technique or taught a new procedure, the German nurses were forced to confront the falsity of their racial education. The irony was palpable. American segregation laws assigned black nurses to care for enemy prisoners, yet even this flawed system produced better outcomes than Nazi racial medicine. Following Italy's surrender in September 1943, cooperating Italian personnel received preferential treatment, and German nurses watched their former allies gain privileges while they remained restricted. This pragmatic American approach, which judged current cooperation over past allegiance, stood in sharp contrast to rigid Nazi ideology. While unrepentant Germans remained under guard, cooperating nurses received a medical education that exceeded the training available in their homeland. American officers freely taught new techniques and equipment operations, sharing knowledge without restriction, from burn treatments developed in the Pacific to surgical innovations from European combat. German nurses meticulously documented every lesson, fully aware that they would soon return to a destroyed nation that was in desperate need of medical expertise. As the war ended in May 1945, American authorities prepared German personnel for repatriation through a comprehensive training program designed to help rebuild their country's medical system. The curriculum covered essential public health topics, including epidemic control, emergency medicine, water purification, and mass vaccination. They were also trained in the treatment of severe malnutrition, ensuring they possessed the skills necessary to address the crises awaiting them at home. Colonel Richard Stevens told them directly that they were returning to massive medical needs, describing the training as an investment in a democratic Germany. The program included establishing clinics with minimal resources, training auxiliary personnel, and implementing broad public health measures. Upon completion, the nurses received certificates documenting their American training, credentials that proved valuable in occupied Germany, where returnees found that 60% of hospitals had been destroyed. These returning professionals brought back not just American techniques, but a fundamentally different medical philosophy that prioritized patient advocacy over ideology. Former prisoners of war established nursing schools that emphasized these new values, implemented American protocols in rebuilt facilities, and copied blood banking systems and antibiotic guidelines. By November 1945, as American personnel withdrew, these trained Germans became essential to maintaining public health. The influence of this program extended far beyond the immediate post-war years, and by 1950, many German nursing schools were led by former prisoners who introduced concepts like nursing diagnosis and continuous education. Pharmaceutical companies adopted quality standards observed in captivity, and hospitals were permanently reorganized following the models witnessed firsthand. This marked a permanent transformation from ideological to scientific medicine, driven by the hundreds of thousands of procedures performed and the education received. The sheer scale of this transformation is revealed by the numbers. A total of 371,683 German prisoners were held in the U.S., with German staff working in over 200 medical facilities. They received more than 100,000 documented hours of medical education, performed hundreds of thousands of procedures, and established more than 15 nursing schools upon their return. Dozens of hospitals in the U.S. zone were reorganized on American models, meaning each trained nurse influenced dozens of colleagues, and each reformed hospital treated thousands of patients. In 1995, surviving German nurses who had experienced this captivity drafted a moving statement acknowledging their past. They confessed to serving a regime where medicine was corrupted into an instrument of death, while witnessing that science and compassion serve life. They noted that Americans demonstrated abundance and technology, but more importantly, medicine without hatred. By treating enemies as patients deserving equal care, these nurses returned home, carrying something far more valuable than mere medical knowledge. We brought a vital message to you, the medical professionals of the future. Healing must transcend the boundaries of nationality and ideology. You must never allow the practice of medicine to serve political dogma rather than the patient. We learned this from American doctors and nurses who treated us, their enemies, as fellow humans deserving of compassion. We arrived as prisoners, but we departed as witnesses to the true, uncorrupted purpose of our profession. The transformation of German nurses held in American captivity stands as one of the most significant ideological reversals of the Second World War. These women witnessed more than just technological superiority. They saw the fundamental ethos of medicine in action, healing, stripped of all discrimination. Their journey from functioning as servants of Nazi racial hygiene to becoming advocates for scientific medicine demonstrates that direct experience holds a power far greater than propaganda. Day after day, immersion in American medical routines achieved what brute force never could, a total reconstruction of their worldview. When 9 nurses emerged from the underground hospital in Cherbourg on July 2, 1944, they symbolized thousands who would soon undergo this same revelation. Although they entered captivity convinced of German supremacy, they left with the humbling understanding that true medical excellence is born from the convergence of science, resources, and universal compassion. This phenomenon represented America's greatest medical victory, proving through the grind of daily practice that humanitarian care inevitably triumphs over ideological constraints. These German nurses were not merely captured in a military sense. They were spiritually converted by witnessing the genuine objective of their profession. This deep internal shift laid the essential groundwork for reconstructing post-war German medicine, grounding it firmly in humanitarian values rather than the toxic principles of racial theory. Their transformation offers compelling proof that even the most heavily indoctrinated minds remain capable of change when faced with undeniable evidence of a superior path. The nurses captured by American forces discovered that their adversaries possessed more than just better logistical support. They held a superior medical philosophy. Where they had been drilled to believe that medicine existed to serve racial ideology, they learned instead that its only true master is humanity itself. The insights gained within the confines of American captivity would go on to reshape the landscape of German healthcare for generations to come. Their story endures as a powerful testament. Medicine rooted in science and empathy will always outlast practices corrupted by hatred. Former captives became witnesses, and sworn enemies became colleagues. Through this profound transformation, the profession returned to its rightful purpose: healing that knows no borders, science that harbors no prejudice, and compassion extended to all who suffer.